My name is Amy Gadu. I'm a senior lecturer in palliative medicine and an honorary consultant at Trinity Hospice, where I work in the community team with my colleague Emma.
Hi, I'm Emma Dawson. I'm one of the advanced practitioners on the community team, and I've been taking the lead from a clinical point of view on palliative care virtual ward.
We focus on patients with life-limiting illnesses, and we very much focus on supporting them in a holistic way for them and their families. And there's an awful lot of patients that would benefit from palliative care that don't have palliative care, so it's about 1% of the population. So across the Fylde Coast, we're looking at about 30,000 patients. The virtual ward is about supporting patients in their own homes, be it in their own homes or other settings such as care homes, supporting them with their complex symptom management treatment, which Emma and her team support with, and also we can have support with carers with a team of healthcare assistants. As clinicians, we're all about patient-centred care, but the benefits of virtual ward can be across the health economy as well, in terms of patients not wanting to be in hospital and us being able to support them at home can also free up busy hospital beds in A&E department. Since we've been running the virtual ward, we've only had 2 acute admissions to hospital.
Main points to remember when we're considering about whether patients may be suitable for virtual ward is that obviously they've got a palliative diagnosis and they've got increased needs. They need to have had a DNA CPR in place. They need to have the just-in-case medications in place. And they also need to have had the scenes of treatment discussed and documented in some form. And phoning up the virtual ward, phoning up and getting in touch with us, and now that can be done via the generic virtual ward number, and that is 01253 958 758, and picking option 4 for the palliative care end of life ward, and that will come through to one of our other clinical leads on the team, and we'll have a discussion about the case and guide you through the process from there. Yeah, and a good example of where the virtual ward worked well is we were spoken to about a patient that was actually in the harbour in the mental health hospital locally, had deteriorated, had been in with them from a dementia point of view for a long period, but had deteriorated and was becoming more clinically unstable and had huge potential to end up being escalated to A&E up at Blackpool Victoria, which does happen frequently and obviously has a huge impact on the beds and the clinical input from the trust point of view. From the being able to be placed on a virtual ward, we were able to support that patient to remain in the harbour, and supported the staff from a clinical point of view and helped the family as well. They wanted him to stay there, and we were able to have that increased support, and he wasn't escalated up to the hospital and he was able to stay there. So that had an impact from him being kept at where he wanted to be and where the family wanted him to be, and also have that reduced impact on the trust, because as we all know that there is a huge number of patients that are admitted from the harbour when they do deteriorate.
Mm-hmm. I think that's a nice example, Emma, and I think it's also thinking about care homes that we can support.
Certainly.
So basically we can go anywhere in the community. The community is really wide. Obviously the majority of the patients we're seeing that they are in their own homes, but I think that's a really good example that the reach is wide. And obviously we can support patients that are in hospital who want to come out of hospital and have their care at home, and obviously that's the group we really want you to help us with identifying.